Hello everyone, my name is Lincoln. Today my colleagues and I will be using this video to bring insight to cultural appropriation. So, what is cultural appropriation? Are you guilty of doing this? Do you even know when you are? Take a second to think about it. Think about what it means to you, what it looks like in your community practice settings. Okay, simply put, cultural appropriation is a practice of the dominant culture, use of another culture's belief, ideas, way of life, and even medicinal treatments, without the consent of the respective culture or the respective group. Now, to help us better understand the concept of cultural appropriation today, I'm going to use the recent article, the recent video of a group of UK nurses dancing and using the Haka dance of the Maori tribe. Now, the nurses' intent might be good. However, the use of this traditional ceremonial dance came without the consent of the Maori tribe. Now, the Maori tribe uses the Haka dance to symbolize pride and strength within their community. When we look at the video, we see the nurses, their dress does not reflect what the Maori tribe would wear when performing this dance. The video did not also come with the blessing or the consent of the Maori tribe. Now, someone might say, well, it is good intent, so why worry? When we look at the research, if cultural appropriation is not addressed, it could dismantle the history of the cultural group, leading to further depression and misrepresentation within our healthcare system. As nurses, it is our responsibility to influence change. I will effect change in my practice setting. As a leader, as a manager in my practice setting, I will influence change and effect change by reaching out and leveraging my leadership role with the discharge planning team within hospitals. We have a number of patients being discharged from the hospitals that aren't identified and recognized as requiring culturally safe care. What I intend to do is have those individuals recognized and then referrals from the discharge planning team sent to organizations like the Native Center of Toronto for further follow-up and community resources. Organizations such as the Native Center of Toronto will ensure that the right nurse provides the right care, and also the treatments for these patients are a fit between the practitioner and the patient. My commitment to change is not only through leveraging my leadership role, but also within my organization. We service multitude of clients and a multicultural community. My company is also committed to ensuring that we have the right nurses that speak the right dialect, that have the right skills and knowledge of the community that they service. Hence our recent accusation of other companies to help us to provide culturally safe care. I hope everyone takes this opportunity to reflect on what cultural appropriation means for them and how they take and what they will do within their practice to influence change. Thank you.
Hey everyone, I'm going to further discuss the terms of cultural appropriation and cultural competency and why these two terms seem to be so complex when it comes to healthcare. The perceived attitudes of clients and hospital staff in regards to cultural appropriation is quite complex. This is due to various definitions of cultural competency and the limited understanding of culture within healthcare. Now, unfortunately, until cultural competency is understood, cultural appropriation will continue to be an issue. Cultural competency continues to be better understood. However, due to the increased terminology under cultural competency and the evolving policies due to the increased terminology, makes individuals less receptive to learning about culturally competent care. A lack in cultural competency evidently leads to increased intentional and unintentional cultural appropriation within healthcare. As the understanding of cultural competency is minimal due to various factors, the perceived attitudes of learning about cultural appropriation is met with resilience from clients and the hospital staff. Healthcare access and utilization shows statistical increase due to a rise of cultural competency shown by the healthcare organizations. Therefore, minority groups are more likely to go to certain hospitals that they have heard are more accepting culturally. Family members may perceive cultural appropriation differently when cultural competency is met. Family members of culturally diverse, especially minority groups, perceive cultural competent healthcare providers with much more respect. Once a healthcare provider is able to culturally understand the individual's willingness is heightened in regards to receiving healthcare that may be unconventional to them, such as using Western medicine for the first time. Attitudes of the big stakeholders of these healthcare institutions are open to exploring the issues of cultural appropriation. According to the RNAO, nurses play a vital role in exploring cultural competence. Allowing for healthy work environments will allow for better care, including culturally competent care. Statistics have shown that due to an increase in nursing burnout and nursing shortage, unhealthy work environments have been on an increase. Having a healthy work environment allows for better nursing-client relationships and outcomes, and allowing for better organizational and systemic performance. This includes providing optimal, culturally appropriate care. Healthcare providers and professionals, alongside their policymakers and organizations, can impact cultural competency policies within their organization. This would begin with the healthcare organizations, policymakers to address their own prejudice and own biases in regards to cultures. This would require ongoing self-reflection and awareness to create accountability for these individuals, allowing for health equity and progress in culturally competent care. Providing professional training and developmental training and education would be beneficial to facilitating cultural awareness and decreasing cultural appropriation within that institution. Providing peer-reviewed, evidence-based education on the importance of cultural safety as a part of accreditation and mandatory certification would be beneficial. Ensuring cultural safety is being consistently evaluated and accredited by these policymakers would be beneficial as well. Now, the RNAO suggests that providing culturally competent care includes insights from subdivisions, such as external policy factors. This includes funding, legislative, the mandatory education that we discussed earlier. This also includes external professionals and occupational factors, meaning that policy and regulation should be provincial and territorial at a provincial level rather than a federal level. So each province or territory has their own legislation in regards to cultural competence. This also includes external social cultural factors, so allowing the community to provide their input into these policies that are being created. Now, with this,
who is involved or who will be involved? So, to support this change is through the engagement with Indigenous healers and leaders, also prioritizing the respectful interaction with the scholars, community members, and local knowledge holders in the First Nations ensures that the concepts, resources, and methodologies used in the Indigenous traditional medicine integrates with the Western medicine system. Also, unit policymaker must be involved in promoting collaborative practices between the healers and the nurses with ongoing exchange of knowledge, information, and insights. It is also considered the facility and the unit must also implement communication strategies that aim to increase awareness and recognition of Indigenous culture that promote cultural appreciation and not cultural appropriation. As for barriers, so potential barriers, so there are several barriers to implementation of cultural change and practice change, and they are values and beliefs. So it is important to know that often barriers may be religious in nature, but also be due to work ethic, competition, and pride that differs from person to person. It is advised that a change agent make him or herself aware of values and beliefs of the community in which the changes are meant for. Second, excessive turnover. So working in an urban hospital, there's just a higher turnover rate in an organization, and this will also effectively serve to delay and short-circuit the development or implementation of culture change because of high rates of change of staff. Third, a lack of psychological safety. So worker may feel anxious when learning new information or methods, or when his or her role or value within an organization is unclear. So furthermore, staff members are not going to change their way of seeing their job and their own role overnight. So it needs time and an effort into training these individuals. Fourth, the need for confirming data. So usually it takes some negative experience to spur change, although it will take some positive data to stabilize and internalize a new cultural viewpoint. If this positive data are not presented, further change may be catalyzed, and depending upon the outcome measures, it may take some time to see the effects of a cultural shift. Lastly, unclear or ineffective processes for attaining goals. So if a new goal may be established, however, senior management may not be clear about how to attain that goal, leaving the employee to adapt a trial and error approach, which would hinder and create a barrier to change. Lastly, in my own practice, I can bring change by talking with my unit manager about incorporating cultural safety into the orientation of new staff and implementing learning modules and training to be completed annually by existing staff. Okay.
The debate between cultural appropriation and cultural appreciation is ongoing, but many argue that when cultural appreciation is done correctly, it fosters a deeper relationship and connection between people of a different cultural background. Sharing culture can be seen as a positive step towards a better understanding and appreciation for perspectives and traditions different from your own. The important difference comes when taking someone's culture without permission or consent, and that runs the risk of cultural traditions losing their meaning for the superficial benefit of most often the dominant culture. Cultural appreciation revolves around a desire for knowledge and deeper understanding of a culture different from your own. For example, if you purchase Indigenous art or other items, you should buy directly from the Indigenous creators. Plus, you must take the time to learn the significance behind the item and how it should or shouldn't be used. Appreciation is when someone seeks to understand and learn about another culture in an effort to broaden their perspective and connect with others cross-culturally. If you show appreciation for parts of a culture, such as clothing, hairstyles, accessories, or treatments in the wellness sector, but remain prejudiced against its people, that's appropriation. Take historical and systemic oppression into account and be conscious about your own privilege at all times. When attempting to appreciate another culture, ask yourself, do I understand the significance of this attire, tradition, or a custom? Ask yourself things like, am I honoring this culture or simply imitating it? Will my participation perpetuate stereotypes and hurt people that belong to this culture? And am I doing this for a personal opportunity to interact and experience another culture? Or am I doing this for a picture to put on Instagram? In my own practice, I can perpetuate cultural appreciation and decrease cultural appropriation by advocating to have Indigenous art done by Indigenous artists in waiting rooms such as in the ER or throughout the inpatient units of the hospital I work at.